Well, October is all about spreading awareness about breast cancer. It is the second leading cause of cancer deaths in women. About 1 in 8 will be diagnosed with the disease in their lifetime. That number continues to rise in women under the age of 50. So joining us now is Dr. Kayla Griffith with HCA HealthONE Rose. Thanks so much for joining us.
Thanks for having me.
Okay, so let's get to the information that's out there. There's so much information. What are the biggest myths or misconceptions?
Basically exactly what you just said. I think everybody strongly believes that breast cancer is a disease of older women, and largely it has been in the history of the United States. The average age is 62 to 64, but we're seeing a huge rise in women under 50 and even under 40. Basically half of my patients here in Denver are under the age of 50, which is pretty shocking.
It is shocking, and because of that rise in cases, early detection is important, right?
That's exactly right. So, it's really important, especially, the average age, the general age to start mammograms in the U.S. is at age 40. And so women under that are not routinely getting that unless they really advocate for themselves and say, hey, I've got a family history of breast cancer. I'm having lumps, bumps, pain, things like that, things that prompt earlier screening. So I think it's about being aware of yourself, advocating for yourself, because otherwise you're not going to get that routine screening. We know that early detection, getting mammograms early, really helps, it helps us with diagnosing things before they're more progressed. And when we diagnose things early, they're more curable.
Yes, and I think something that we don't really put a spotlight on is breast cancer also impacts men.
That's true. It's rare, less than 1% of all breast cancer patients are men. We say that incidence, instead of the 1 in 8 in women, is 1 in 726. That's a big number, but when you're that one, it's a lot. And again, men aren't getting routine screening. So when they do present, it generally is a much more advanced stage.
So for anyone at home right now who is nervous or a little scared, what would you say to them?
I would say, we've come such a long way in the breast cancer world. Things that, even 20 years ago had 50% survival rates, and we couldn't necessarily say we were treating for a cure. Now, if we catch things early enough, we have treatments and cure rates in the high 90s, approaching 100 for a lot of these cancers. It's huge. We've come such a long way. Just continue to advocate for yourselves and speak out.
This is all important information. Dr. Griffith, thank you so much.
Thanks for having me.
And remember, you can watch all of our interviews on our website, cbscolorado.com.
All right, well, tax